Hello. Good morning, fellow friends and loved ones. Yes, it's been a while since we had a discussion. Yes, the last time we had discussion was on skin grafting. Um, we had an extensive discussion on skin grafting, and we planned on another topic, and I'm sure you are abreast with the topic. So I guess it's quite an early morning. We scheduled the time to 3:30. But then it looked as if yes, work would not give me the chance to be able to have this discussion, for us to have discussion. So we had to reschedule it, and this morning it's exactly at 9:50, and we have about 20 minutes of the discussion. And I believe that we'll have a very interesting discussion this morning. And so we're having a discussion on the topic pressure ulcers. Or the normal name is called Bedsores, or we could have the scientific name also called Decubitus ulcer. Yes, so these are all names that we can mention this condition as either pressure ulcers, bedsores, or Decubitus ulcer. And so we begin this discussion in the name of the Father, and of the Son, and of the Holy Spirit. So what is pressure sore? What is bedsore? Yes, so it's actually a presentation on various parts of the body, where you could see that the part of the body looks like a sore. It could be in a form of at the surface of the skin. It could be deeper, and it could be much deeper. And so we delving into how this condition comes about, the various ways of preventing them, and the various ways of managing them, and then also the various ways of treating them. So you can also share the link to join people, to allow people also to join this discussion. Yes, so it's actually a skin and soft tissue injury that forms as a result of constant or prolonged pressure exerted on the surface of the skin. So there's prolonged pressure exerted on the surface of the skin that causes the skin to either be exposed or to be moved away. And so I'm looking at some pictures also showing us what the decubitus or ulcer or the pressure sore is, and we could see there are various instances where this condition occurs when we have prolonged being at one position. So you can be at sitting for a long time, and you also can have it by lying for a long time, especially those who are not able to move. So those who have gone through a surgery, or those who are bedridden, when they are at one place for a long time, they are likely to have this condition we call pressure sores. I'm sure if you've been to the hospital before, you've heard of something called pressure sores, but we'll be having a very extensive discussion today. And so it's actually a soft tissue or skin, so it affects the skin. So the skin can either peel off, going down deeper to, you have something called the subcutaneous tissue. So you have the muscles and you have the bone. So when it gets to the bone, it means it's very extensive. It means it has gone to the worst form of the pressure sores, and this could be very, very difficult to treat and could lead to something we call the ulcer. Okay, so actually this condition occurs at every bony area of the body. So we have various positions of the body, or various parts of the body. We have the elbow, we have the hip, we have the knees, we have the heel of the foot, we have the occiput, the head region. We could have some at the shoulders. Yes, these are various parts of the body that we can have them. So we're giving you a very extensive part of the body. You can have some at the buttocks too. Yes, these ulcers or pressure sores or bed sores actually occurs as a result of you not moving for a long time. As we mentioned earlier on, it could occur around the sacrum region, that's around the buttocks region. There's a bone in your buttocks called the pelvis. The pelvis has so many bones. It has 3 bones. We have the ilium, ischium, and pubis. So the pubis bone is actually the last bone downwards, and the first bone upwards is the ilium. The middle one is the ischium, and the below the ischium is called the pubis. So the ischium is the middle part, and that's where there is a lot of pressure that is exerted when the person or the patient lies down for a long time. So the ischium is affected because the bone has undue pressure on the skin to the muscles. So we, as scientists and as medical practitioners, research have been carried out and has realized that the ischium has more contact with the muscles and the skin that makes the body or the buttocks region being predisposed to pressure sores or decubitus ulcer, or we have the Bedsores. Okay, so we'll continue our discussion. So it mostly occurs in people with conditions, as we mentioned earlier on, which they are unable to move as best as possible. So what are the causes of this condition? It's actually has a multifactorial cause. It could be as a result of poor sensation around the parts of the body. So when the person lies down, the person cannot really feel well, so he or she doesn't really have an edge to be able to change position of the body. Someone can have a stroke, someone can also have probably a spinal cord injury, the person has had a surgery and come back, and so the person doesn't really feel an ability to change or move to a different position, and constantly being at one position for hours could predispose the person to having something we call the bed sores or pressure sores. And so we have two main factors that causes this condition we call bed sores or pressure sores or decubitus ulcer. We have the external factors and then the internal factors. The external factors as a result of friction. So when we have friction between the bone and the muscles and the skin, this causes an external pressure onto these structures, and then when they affect structures we call the blood vessels, they begin to reduce the amount of blood onto the side, and this causes something we call necrosis, where the tissues begin to lose their function, and so then it predisposes the body to something we call the pressure sores or decubitus ulcer. Also, we could have shear forces. That is where we have undue pressure between the bed. So if the person or the patient is lying on the bed that is not really soft or that doesn't have any air contact underneath, the person could have extra force, and that we call shear forces between the bed and then the surface of the skin. And when this happens, it causes the skin to wear away. It causes the skin also to lose its strength and its viability. Yes, and so this causes something called pressure sores. So we'll be looking at some pictures very soon, so just stay tuned, and you can share also the video, the live video, onto your various Facebook platforms, and I'm sure we'll have a wonderful discussion. And if you have any questions, your questions are welcome. You can just place the question on the Facebook platform. Okay, so we mentioned external factors, internal factors. External factors also, one is what we call moisture. So if there's a lot of moisture around the structures where there's high predisposed tendency of having bed sores, such as the elbow, such as the buttocks region, such as the knee region, such as the heel region, the person could have bed sores. And also the internal factors as a result of fever. So if the person has fever, then there is very little mobility, so the person lies in bed and shivering for a long time, and so the person could have bed sores. And if the person also doesn't eat well, if you don't eat well, you're likely to have bed sores. But these are all mild factors. The person also has anemia, the person has endothelial dysfunction. That's when the vessels that's supposed to supply the blood are not able to really allow effective blood transmission to the various parts of the body. So this will cause poor circulation and could cause bed sores. Yes, and so we classify the bed sores under so many categories, but that is the stages in the bed. And so we have about 4 stages. But before we talk about the 4 stages, we talk about just a brief formation of this bed sore. So when someone has bed sores, how will they identify bed sores? And so we have 4 stages. We can identify bed sores by 1. So if the person lies at a particular place on a particular position for a long period of time, probably 2 hours or 3 hours or 4 hours more, or more, the person can see around the skin a reddish, or the place becomes warm to touch. And so there is poor circulation around the side, there's poor oxygenation, there's poor oxygen. Let's remember that as the blood flows, it carries oxygen, where oxygen is very important for the tissues to stay alive. See, the person is lying on their back and the blood is not able to flow right into the buttocks region, and as a result of the bones pressing against the bed or against the skin, it causes poor circulation to the distal part. When you say distal part, it means that beyond the bone region. So if it's my finger like this, if the blood vessels are going through to the tip of my finger, if there's too much pressure here, there could be poor blood circulation to the tip of my finger. And so the tip of my finger will be described as the distal part of my finger. When you say proximal from this point is away from my finger, that is from this side, that's downward, yes, and the distal is around the side. So there will be poor circulation at the distal part of my finger. And as time goes on, for pressure sores, it could just happen within some few hours. That's about 3 hours, or even at least 2 hours. So 2 hours or more, pressure sores can develop. But then we have severity. We have stage 1, stage 2, stage 3, stage 4, and we have serious ones that we refer to as the Edgecar type or the cavity type, and these are very serious ones and they require surgical management. And so let's take note of this. So if someone of yours, some relative of yours or a relative of yours has this, we can be able to take the best and then the early measures of treatment or prevention as best as possible. So we have the person lying down for a long period of time. This causes poor circulation. There's poor blood circulation to the sides where blood is supposed to go to. If it's the elbow, if it's the knee, if it's to the heels, there's poor circulation there. It causes necrosis, but before necrosis, it causes something called ischemia. That is, the blood vessels don't get enough blood. The blood vessels away from the part away from the heart doesn't get enough blood, and so the tissues begin to form something we call sores, and so pressure sores. So we'll see in the pictures very soon. So we talked about how this pressure sores are formed. We talked about the causes. Yes, that's prolonged lying in bed. We could have internal factors and external factors, and so we're talking about now the risk factors. When we say risk factors, what do you mean by risk factors? We talked about things that could make us get Bedsores or could give us pressure sores or Decubitus ulcer. One, we have a heart condition, a cardiovascular disease, and we have a neurological disease, such as spinal cord injury, such as we have myasthenia gravis, you have CVA, so many conditions, and this could are risk factors that could cause us to have Bedsores. Primarily when you are not mobile or you sit down for a long time, there are some structures that there's some specific point that could give us Bedsores. So I talked about the epidemiology worldwide. It is realized that it's actually a cause for concern, especially for hospitalization. For those in hospitals, about $1 billion is spent in the United States of America for this condition in terms of treatment as early as possible, and so it has been noted to be one of the high costs for treatment in terms of hospitalization. So people who are in hospital for about 2-3 days are likely to have Bedsores. So it has put a lot of cost in terms of managing this condition called the pressure sores or Bedsores. Okay, so that is in 2008, America realized that it was spending about billions of dollars in terms of year treatment of this condition called Bedsores or Decubitus ulcer or pressure sores. It could spend about more than $3 billion or $3 million dollars in terms of treating this condition. Yes, so statistics in America show that 3 million adults suffer from this condition called pressure sores or Decubitus ulcer annually. Yes, and so And then there's that about 2/3 of the people are above 70 years. So 70 years and above with various underlying conditions such as the neurologic disease or neurogenic disease and the cardiovascular disease, and then dehydration. So in as much as in a hospital, you also need water. When you have less water, you predispose your tissues or your structures to less amount of water. And let's take note that water forms about 70% of our body, so we need to replace them. We lose water at any point in time, even whether the weather is cold or whether the weather is hot. There are various means of loss of water, and our skin is the largest part of the body. We're talking about the Decubitus ulcer, which is mainly a presentation of the skin. That is when we have injury to your soft tissues of the body, that is the muscles and primarily the skin. Okay, so there are various points that we need to take note of. The fact that when someone is immobile, when someone has incontinence, that is when a person is not able to pass out urine, yes, and also when the person is debilitated. So a sick person who is in the hospital, who is not moving and is stationary at one place, is likely to have pressure on the skin, and then this could predispose the person to have bedsores. Okay, and we mentioned that earlier on that spinal cord patients, so spinal cord, those who have spinal cord injuries, they can't move because even when they move, they are going to cause worse problems. So they are stabilized, they are immobilized, and this helps to recover them to recover. But at the expense of recovering, they are likely to develop this condition called the bedsores, where there is undue pressure at various sections of the body. So, and so shown that about 83% of patients, that is statistics showing that 83% of patients have bedsores when they come to the hospital for admission. Yes, so how does this condition come about? As you mentioned, there is so many pressures at the various joints of the body, and the circulation is blocked. When there's poor blood circulation to the joints of the body, it will cause bedsores or pressure sores. And so we have various complications that could result in bedsores. So one is a condition we call cellulitis, and actually this is actually an infection of the skin. It could have infection of the skin or the soft tissues. We could note that cellulitis has occurred when the patient's skin is warm to touch and it's reddish in color, and then most importantly there's a swelling at that region. So if there's swelling around my elbow region, I can see some watery fluid around my elbow region or my knee region or my buttocks region, and when you touch it, you feel that there's a shifting of the watery fluid around the skin. This could indicate that there's a first stage of this condition called bedsores. But when you take note of it, it goes into the second stage and the third stage and the fourth stage, and then a serious stage that we call the either the ulcer type or the cavity type, where there's a deeper wound created. Okay, so we have cellulitis as a complication of this bedsores. So when you have bedsores and you don't treat them well, you could have cellulitis. That is when bacteria and other organisms come into contact with the skin, the exposed skin, and this could be very serious. When we also have a bone infection, we have something we call the osteomyelitis. I'm sure we talked about osteomyelitis some weeks ago or some months ago. So if you want to have a detailed explanation of osteomyelitis, you can just log into Facebook or YouTube and osteomyelitis, and we had an extensive discussion on osteomyelitis, and I'm sure you will enjoy it and you will learn a lot. Osteomyelitis, that's the bone infection, and if you also have a skin infection such as septicemia, it could have bedsores. So infection of the skin should be taken notes as early as possible, and our professionals, the nurses, they are very good at it. They are very good at taking care of such condition, and the doctors also are very good also at doing that, of prescribing various medications, antibiotics to manage these infections. Also, we have cancer. So when you have cancer or wounds that do not heal prolonged chronic wound. When you say chronic, it means it extends to 6 months and above, getting to a year where the wounds are not getting healed. Then the person could have bed sores or pressure sores. So these are some of the complications of pressure sores or Decubitus ulcer. So now we talk about the stages of pressure sores or Decubitus ulcer. We have the stage 1, where we have the stage erythema of the skin. That is the reddening of the skin. So you can see that the skin is reddened, and then some swelling around the skin, with some watery fluid around the skin. Some people could say it's blisters, but then it's a form of pressure sore. But in the second stage, you could have the loss of the partial thickness of the skin. That is, we have layers of the skin. The first layer is called, what we see is called the epidermis. Under the epidermis, we have the dermis, which is a bit thicker than the epidermis, and then we have subcutaneous fats, and we have the muscles, we have the blood vessels, we have the hair follicles, we have the bone. So the bone is actually the last portion of the body before we have organs around these structures. So we have the reddening of the skin in the first place, and then the second one, where you have still reddening at the same time loss of the partial thickness. So we have the thickness of the skin being loose as compared to, you can really see the difference between the normal skin and then the pressure sore skin. The third one is where we have the full thickness in the skin being lost. So you could have a cavity formed around the portion where we are having the bed sores or the pressure sores. And the third one is actually, you could have the loss of the skin getting to structures we call the muscles. The second one actually is just the surface of the skin and just under the skin where we call the epidermis. And the third one is where we have deeper structures where we have involving something we call the subcutaneous fats. The fourth one actually goes down into the muscles. So we have, in terms of extensivity or the severity, we have the fourth one being the most severe. Okay, so what are the symptoms of bed sores or pressure sores or Decubitus ulcer? You would have discoloration of parts of the skin. You could have the skin having different colors compared to the other portions of the skin. You would have patches of the skin turning white when pressure is applied. So if the sore is around my elbow region, when I press it, I can see the portion of the skin that I press, that's it, close to the side, being whitish and doesn't look reddish as compared to the other portion of the skin, because every portion of the skin has some amount of blood supply. You can see the reddish. So I'm sure when I do this, you can see from my thumb some reddish of my skin. If you don't see this reddishness there, you're likely to have bed sores, that is being whitish. Also, you can have the skin around the side being hard and then being a bit spongy, and then also being reddish and then warm to touch. So if you put your hand like this, the place looks warm to touch. These are the signs of bed sores. And also the person could have itchiness or pain around the side. But then it's advised that when you have bed sores, especially the stage 1 and the stage 2, you don't really scratch the side, because it could form a wound, which the wound could be very difficult to heal, especially if you have other underlying conditions such as diabetes. It's very important that we take note of that. If someone who's having the first stage of bed sores doesn't really itch or prevent or the reality prevents him or her from itching that side, and this could be very severe. So these are the early signs. But then the second or the later signs could be as having a blister or having a very extensive wound, that is a deeper wound, which goes down the skin to the subcutaneous fats and down to the muscles and the bone. That's the last place that it reaches, and that's where the stage 4 is, or the cavity type. Okay, so if one person or a patient is at the hospital and presents with bed sores, how can we identify it as health professionals? So we have various stages of identification. We have one, a blanchable erythema, that is when you put pressure on the skin, you could have the whiteness of the adjacent part of the skin, and also the fact that it's relieved in terms of the bed sores is resolved in terms of after about 24 hours. That is when we have the very less severe one, the stage 1 type. in about 24 hours, the skin will resolve into its normal state. But the extensive one, that is the stage 2, stage 3, stage 4, it takes a lot of wound care management, and also the severe type surgical management. We have skin grafting. That is, we talked about it last time, so I'm sure we can appreciate it now. If you've lost part of the skin, we need to find a portion of the skin from other parts of the body and attach it to it to be able to survive, because when the blood vessels are exposed, they can be destroyed, and if you have destroyed blood vessels, you could have bleeding, and if your arteries are bleeding, your veins are bleeding, you could die, because then there's no circulation, there's no going and coming. Yes, it's just going, the blood is just going, so there's no returning of blood to be able to survive. So it's advisable that if you have ulcer, either you go for surgical management, or if it's not deep, you go for wound care management, and this helps to allow the patient to survive and live normal life. Okay, so how we diagnose this condition called Bedsores? Yes, we have so many ways. So we can, by observation, that you can see the place being reddish, and then by palpation or touch, you can see the place being looking a bit warm to touch, and also you can see various. We can give antibiotics as early as possible to treat this condition. So how do you treat this condition? Actually, the nurses actually play a very important role by dressing, and then also doctors also give antibiotics, and also physiotherapists also actually come into place to prevent any stiffness, and also to allow circulation, and also the nurses also do turning, so they turn the patient in and out to be able to ensure that there is efficient blood circulation. So how do you prevent this condition? By one, appropriate skin care. So we have good skin care. Some people patients or nurses use medications such as Stifodem. There are so many skin medications that help to prevent pressure sores or Bedsores, and also continuous positioning, so repositioning, so turning in bed, regular turning in bed. That's every 2 hours we turn patients in bed. As nurses, we turn patients in bed to be able to ensure that there's efficient circulation. If someone has spinal cord injury, someone has CVA, someone has a condition that requires the patient to stay in bed for a long time, regular turning of the body of the patient is very important. Every 2 hours we have dressings, and also we have antibiotics by medical doctors. And also eating your food, that is where the dietitian come into place to give the patient enough food to ensure that effective wound healing, because our food, our protein, our diet, our fiber, our carbohydrates are very important, and the dietitians are very important in terms of giving the right and appropriate nutrients to ensure good wound healing. And also the psychologists also come into place to ensure that yes, there is a sound mind of the patient to be able to ensure that the patient recovers very well. And so I said that the medical doctors also do something called debridement, that is washing the particular side very often to prevent infection of the site. Okay, so I'm sure we are learning a lot from this condition. Now we look at some pictures to show us what we are talking about, and then I'm sure we'll come to the end of our discussion. So some of the pictures of the pressure sores. Okay, so here we go. Just give us a minute. Okay, so yeah, I think we are ready. Okay, so this is the picture. I'm sure we can see it from here. So just a minute. So yeah, so this is the picture of the skin. Yes, I'm sure we can see the skin now. Yes, we have so many layers of the skin. Yes, so let's start. So this is the bedsore. this is the wound, the skin here. We have the epidermis here. You can see it here. The first layer of the skin. You have the dermis, and you have the subcutaneous fat, the yellowish one. And this gives us a deeper traction. You have the muscles here. This is the muscle. This is the bone. So these are layers of the skin. And so this is a very deep one, deep bedsore, where you have entering into the bone. I'm sure it's the stage 4 type. So these are the points where you can have pressure sores. So you can have at the ear, the shoulder, the elbow, the hip, the thigh, the leg, the heel. Yes, when you're on your back, you have it at the back of your head, the shoulder, the elbow, the buttocks, the heel. When you're lying on your stomach, so you can have it at the elbow, the rib cage, the thigh, the knees, the toes. So these are the parts of the places that we can have bed sores. So let's take notes. So when we position the patient in a particular position, or the person in a particular position, we can be able to know where we can have the bed sores. Okay, so this is also the stages of the bedsore. You can see this here. You can see the reddish nature of the bedsore. Okay, so I'm sure we can see it now. The first one is the stage 1 type. So the stage 1 type, where we have the skin reddish, and the second one is the stage 2 type, where we can have it going down. You can see it here going down from the epidermis. The first layer is called the epidermis of the skin, and then the second layer is called the dermis. So the second stage of the bedsores actually is more extensive. It's more extensive, and so than the first one. Then the third one goes from the skin, the epidermis of the skin, down into the subcutaneous fat. So you can see the subcutaneous fat. That is it here. Yes. So this is the subcutaneous fat. Sorry. Yes, subcutaneous fat. You can see it here. And then the fourth one is goes down into the muscles and touches the bone. So this is the bone. You can see the bone here. This is the bone. So the first one goes just the skin. The second one goes a little bit down the skin into the beneath the skin, called the dermis. And the third one goes away from the dermis, goes down into the fat tissues, the subcutaneous tissues. The fourth one goes and passes the subcutaneous tissues to the muscles and gets to the bone. And this could cause other conditions. We have osteomyelitis, septicemia, so many infections. Okay, so this gives us a very good picture of where the pressure sores can occur. That is when you're lying on your back. So we've seen the other positions: lying on your stomach, lying on your side. See that these are lying on your back. These are the points where you can have the bedsores. Lying on your side, these are points where you can have the bedsores. And lying on your stomach, this is where you can have the bedsores. Okay. So we continue. This is the skin. This we mentioned earlier on that's the epidermis. This is the dermis. This is the subcutaneous tissues. That is the yellowish presentation. These are the muscles, and this is the bone. The bone, the muscles, the subcutaneous tissue, the dermis, and the epidermis. Okay, so this is also a picture of where we can find the bedsores: the heel region, the sacrum region. So this is what I was talking about, the sacrum region, and this is called the ischium, the bone ischium here. And then this is the shoulder, and then the head region. So I mentioned the occiput region earlier on in an earlier seconds or few minutes ago. So this is a very good picture of the bedsore. This is the first stage where we can have this turn upside down actually. So this is the skin, the epidermis, and this is the second stage where it has crossed the epidermis to the dermis, the inner layer of the skin, and then the deeper one goes to the subcutaneous tissues, and sometimes doesn't get to the fascia though. This is the fascia, doesn't get there though. And then also gets the very extensive one, that's the stage 4 one, causes necrosis, poor circulation. And then the best option now in this case, we go for surgery. So surgery is the only option in terms of the 4th stage. So this is also the bedsores. Another very brief explanation of the bedsores. The stage 1, the erosion of the skin, the formation of bubbles, that is this one, the blisters, and also damage to the skin, necrosis, and goes down and forms scars, eschars or cavity ulcers. So as we mentioned earlier on, this is the serious type. So you can see the serious type as we saw earlier on. So this is a serious type. I mentioned it earlier on. Yeah, this is a serious type. You can see it here. This is the serious type, and that is what is being explained here. So this is a serious type. Okay. So this is also one explanation of what we talked about earlier on, the types of the pressure sores. Okay, another one here, stage 1, 2, 3, 4. So even if you not learned anything at all, we could see that we have 4 stages of the pressure sores, the Bedsores, or the Decubitus ulcer. I'm sure we will. And this is also a very summarized version of what we talked about in the few minutes. So this is also how it occurs, the mechanism of occurrence. The pressures from the mattress go down into the epidermis and cause the first stage. If it stays long for about 2 hours or more, it can go down and upward and form and occur to the dermis. Then it goes down to the subcutaneous tissue. Then if it's a longer time, it could go to the muscles, then further to the bone. That is when it's quite a long time. So you can see a patient here. This is a physiotherapist trying to manipulate the back, but the patient has the Bedsores. It could be so many reasons as a result of maybe a burn, which will cause an ulcer. It could also be as a result of prolonged immobility, other conditions. So this is an example of the Bedsores. You can see the reddish layer here. Okay, so this is also another posture where you can have a Bedsores. So in a case where the person is in a wheelchair, the person could have it around the shoulder region, the buttocks region, the heel region, and then the ball of the foot region. Yes. So per the posture of the patient or the person, the joints are specific for infection or affection. So this is also a summarized form of the stages of the Bedsore. Okay, another one here. Okay, so this is the slide that was posted on earlier on for our discussion. Okay. So I'm sure we've seen a lot. Yes, so I'm sure we've learned a lot from our discussions in this morning's presentation. Yes, and we are very much alert, and we've learned a lot from our discussion, and we'll be in a very good position to go to talk to many people about this condition called the pressure sores or Bedsores. I'm very honored, I'm very grateful for your time, and I'm sure our next topic will be very interesting. And then this will be a surprise, so we won't tell you the next topic for now, but then just log in to our page, our Facebook page, and then we'll give you our next topic. Have a blessed morning. It's 10:28. May the good Lord be with us, or have a wonderful day, have a blessed weekend, and take care, and we love you. And thank you very much for your voting and everything. We are hopeful, we are praying to God that we be winners, we all and be winners, and their foundation moves high and moves to the peak, and we help and offer help to many more others. My foundation is RICOY Health International Foundation. Have a blessed morning and have a wonderful weekend. May the good Lord be with us all. Bye. Take care.